turn our attention to health news tonight. According to the Common Sense Institute, the state of Iowa has 17% fewer physicians per capita in rural areas like Sioux County compared to more urban areas like Sioux City. Now, this leaves more rural residents at a greater risk of worse health outcomes if a health emergency happens. But one rural Northwest Iowa hospital is working to change that. Orange City Area Health Systems in Sioux County is looking ahead to its future and the future of its patients and doctors. The hospital is currently undergoing a construction project to add additional space, including a new operating room. The hospital CEO says growth is critical for a rural hospital.
Some people don't recognize is the economic engine that's involved in this, and to be able to keep cases here, surgeries here, care here, employment here is just a boom for the entire economy.
Alongside its construction comes new technology. Hospital leaders say it's important to keep up with medical technology, not only as a benefit for its patients, but also to bring in top talent.
The future of medicine, as we say, is here, but it involves technology. And to be able to attract talent in the future, whether that be in techs, nurses, and surgeons, you're going to need to have this kind of technology, because they're all being trained on it in residency.
Now, that growth in technology recently came in the form of a surgical robot. The Da Vinci 5 is a surgeon-run system for those that need some general surgery procedures done. Orange City Area Health unveiled the new technology last month and gave KTIV's Katie Koppel a closer look.
With a robot, you can control the arms, switch the arms, apply cautery, apply energy, control the camera.
Inside an operating room at Orange City Area Health System in Orange City, Iowa, a large box with 4 arms sits folded alongside a hospital bed.
We're the first in our region to have something like this.
In the corner of the room, Dr. Brent Nykamp uses his hands and his feet to operate, but he isn't touching the patient. A robot is.
So this 3-part system here is a DV5 robot from Intuitive Surgical.
The Da Vinci 5 is a next-generation robotic-assisted surgical system. It allows surgeons like Dr. Nykamp to perform minimally invasive surgical procedures by translating the surgeon's hand movements on the console into precise actions inside the body.
So it allows for better visualization, less fatigue for the surgeon and the staff. We can be more precise with certain things like suturing robotically versus suturing laparoscopically.
With the 4 surgical arms, doctors like Dr. Nykamp can perform operations such as colon resections, hysterectomies, and hernia repairs with better visualization and safety for patients. This, in turn, can lead to a quicker recovery.
So ultimately, there'll be improvements in patient safety as well as in outcomes in pain and conversion to more traditional open procedures.
Dr. Nykamp says bringing the DV5 to Orange City Area Health benefits the surgeons and the patients seeking care at a rural hospital. In Orange City, Iowa, Katie Koppel, KTIV News 4.
Orange City Area Health says they are the first rural hospital in the region to have this surgical technology.